The long-term treatment plan for hemifacial microsomia is really customized to each child. At birth, when we assess the facial asymmetry, we can talk with the parents about what may be involved in their care, but we really follow children every year and see how their facial features evolve and continue to revisit and talk about what interventions are needed and at what timing. For instance, there are some treatments that can be done in infancy. These primarily include taking care of ear tags or extra cartilages around the ear that may be right in front of the ear or down lower on the cheek, procedures for the corner of the mouth, or a condition called macrostomia where the mouth is enlarged can also be done in infancy. But most of the other procedures don't happen until later in childhood. And the next sort of developmental time period would be around 5, 6, 7 years of age when we start looking at the ear.
The number of operations that a child with hemifacial microsomia will need throughout their lifetime is incredibly variable. This depends entirely on which structures of the face are affected by the diagnosis. There will be some children who will require construction of a missing ear. Others will require an operation on their jaw to create centering of the jaw and get the bite to fit well. Some will require augmentation of the thickness of their soft tissue, or something that helps improve the function of the nerves of the face, or even removal of some of the tags of skin that can occur naturally at birth. But not all children will need each of these operations.
The prognosis for ear construction is good, but the timing is key. Child needs to be grown large enough that we can plan the size of the constructed ear to match the other side when it's done growing. Fortunately, ears stop growing by around 5 or 6 years of age, so we can start ear construction as children are entering the school years. Depending on what type of ear construction they do, we may need to wait even a few additional years for the child to be large enough to have sufficient cartilage to use for what we call an autologous ear construction, which uses their body's own material. And when we're doing that type of ear construction, the child may need to be closer to even 8, 9, or 10 years of age to be ready for that.
Timing for jaw surgery in hemifacial microsomia is extremely variable. When function is maintained, it's best to let the lower jaw grow to its final form. At that point, an operation to correct the asymmetry in the jaws will remain stable for a lifetime. There is an opportunity to intervene on jaw asymmetry earlier in the growth phase. This can help with symmetry and function in the earlier years of childhood. However, as the jaws continue to grow, it is very common that any corrected asymmetry returns, and so a final operation to correct the asymmetry forever is usually necessary. There are several options for jaw corrective surgery in children with hemifacial microsomia, and the best choice depends on the amount of asymmetry and the amount of normal jaw structure that has grown. Some children will benefit from a simple operation that can be done from inside the mouth and allows both the upper and lower jaw to become centered and get the bite corrected. Other children will not have enough normal growth of jaw structure to allow that, and so instead will require some grafting of bone from other parts of the body, sometimes from the ribs or from the leg. Nowadays, we can use modern technology to create new jaw bones out of metal and plastic constructs that can be virtually planned and created in a very customized fashion to fit the missing portions of the jaw. Distraction osteogenesis is an operative technique that allows bones to be lengthened. This is accomplished by making a fine bone cut and moving the two segments of bone away from each other at a slow rate. Because the movement is so slow, the body thinks that this is a fracture and lays down normal bone for healing. In essence, this makes a bone longer. This technique has been used in many areas, including the asymmetric jaw growth that occurs in hemifacial microsomia. This is a great way to improve facial symmetry during growth. Unfortunately, though, we do see a lot of relapse of asymmetry as children with hemifacial microsomia grow into adults. As a result, we do not use as much distraction osteogenesis in growing patients with hemifacial microsomia as we once did. Distraction osteogenesis may still be an option for correction of jaw asymmetry after growth has been completed.